Madam Chair and members, I bring you Senate File 1641 because literally thousands of Minnesotans on this very day are living with symptoms of illnesses and disorders that cause a tremendous amount of discomfort and pain, and existing therapies are failing them. In some cases, even creating a whole host of other issues, side effects, addiction, and sometimes even worse. In the meantime, they're being denied safe access, legal access, reliable access to a substance, cannabis, that can, in many instances, as shown through some research and experience, to help alleviate some of those issues to a greater or lesser degree.
As we have been researching medical marijuana for our son, we learned it is helping children with epilepsy like his, resulting in greater seizure control and with minimal side effects due to the low toxicity of the medicine. We have met the parents who have shared these stories, and we've read countless stories. We have also spoken to researchers from a biotechnology firm in Oregon. They are using existing research to develop lab-tested marijuana-based medicines designed to treat specific symptoms, including seizures, by tapping into the potential of all the medicinal applications the plant has to offer. They use this research to help patients, physicians, and legislators in that state really understand the science of marijuana. Children in Colorado and Oregon and other states where medical marijuana is legal are receiving this treatment now, and they are seeing results now. Unfortunately, the current laws in Minnesota prohibit us from accessing this real and viable treatment option for our son. We love Minnesota, we love our family, friends, and our lives here. We have an amazing network of support, and we love our jobs. We respect and care about the physicians that treat Wyatt and want their guidance in all medicines that we administer to him. We don't want to move, but if this law doesn't pass, we will be forced to leave to give our son the chance to have a better life, a life that he deserves.
Stephanie was not going to die from her melanoma skin cancer. Stephanie was going to die from starvation. At that point, my other adult children began begging me to let Stephanie use marijuana in my home. She had the finest doctors and hospital available here in Minnesota, and I mistakenly believed that if an illegal drug was useful, it would already be available. I was too scared, and I didn't believe it would be beneficial, so I refused. Her older brother then took her out of my home so that she could use it. When she came home 3 days later, I felt like I was witnessing a miracle. Stephanie looked better than I had seen her in over a year. She was eating again. For the first time in months, she was eating 3 meals a day and keeping the food down. And for reasons I don't know, marijuana also seemed to enhance the effects of her pain medication without making her feel high.
As health commissioner, as a physician, if this is going to be part of the medical armamentarium, I would want to make sure that we have quality products, consistent products that have been researched and studied so that they can be part of the medical armamentarium to deal with disease. It is as opposed to a natural food that may or may not have some benefits and may be quite variable. I believe that this is important enough that we do need to do some research, and lots of research is being done. We need to look at the components of particularly the CBD and its impact, there are companies and researchers that are looking at this. It may not be moving as fast as some people would like, but that is the approach that we take in our society, in our medical care system, when there is a new medication being proposed, that it go through the procedures, because it's there to protect the safety and benefit of everybody in our society.
Marijuana research showed that regular marijuana use contributes to and exacerbates mental health issues in individuals, and that marijuana users who consume larger doses may experience acute psychosis. And there are a number of studies, Madam Chair, members, that link chronic marijuana use and mental illness. Now, I'll be the first to say that those studies also leave a lot of unanswered questions. And there's much to confirm and to better understand those linkages. But I think it is another reason that I would urge great caution as you proceed, caution about expanding the availability of marijuana in our state.